Good afternoon, everyone. I'm going to go ahead and get started. My name is Scott Allen. I am the CEO of the Family Medicine Education Consortium. And welcome to our webinar today. Public Service Loan Forgiveness has changed and you may qualify. We're presenting this in collaboration with Navigate, who you're going to hear from in just a minute. But we think it's an important service for the FMEC to be helping our members, residents, doctors out in practice deal with their loan balances. So this is a great service that we're happy to be able to provide to you. Just want to give you a little bit of information about the FMEC. We're a catalyst and a convener and an incubator. Hopefully most of you know who we are because you got the invitation to come to this webinar, but if it got passed on to you from someone else and you don't know much about FMEC, let me tell you just a little bit. We promote family medicine and primary care to medical students by bringing students on scholarship to our annual meeting to learn about family medicine and to meet family medicine residency training programs. We support residents as they transition in their careers, helping them figure out practice models and deal with things like loans, and also giving them opportunities to present at our annual meeting so they can do some scholarly activity and learn, get a little bit more experience presenting. We strengthen academic family medicine through faculty development, mentoring, leadership experiences, bringing faculty members together at our annual meeting and helping them learn and share from each other. And we also create and sustain quality improvement initiatives around topics like integrative health, low birth weight, and others. And we stimulate innovative approaches to primary care service delivery. We serve 14 states and the District of Columbia, which is pretty much the Virginia's and North and Ohio and East. There's a little map on your screen. We have both individual memberships for residents and doctors out in practice and others, and also organizational memberships for health care institutions, residency programs, medical schools. We're led by a 15-member board of trustees. We do learning collaboratives. We do an awards program, which is open right now. So if you want to nominate yourself or someone else for an award, go to our website and you have until May 6th. And of course, we do our annual meeting in the fall. This year, it's in September 16th through the 18th at the Hyatt Regency Crystal City in Arlington, Virginia. So we hope you'll join us for that. Registration will open in just about a week. There's the meeting that I just mentioned. So today we're going to hear from three speakers. Joy Sorensen Navarre is the president and founder of Navigate, who will be kicking us off with her presentation. And then we're going to hear from a couple doctors who have worked with Navigate and had good experiences. Ben Frederick from Penn State College of Medicine and Josie Conte from the Maine Dartmouth Family Medicine Residency. And I'll let them introduce themselves a little bit more when they start speaking. But with that, I want to do a poll and see who is today. So I'm going to launch the poll. Hopefully you're seeing that on your screen. If you could just click on where you are in your professional career right now, either in medical school and postgraduate training, practicing or teaching, in administration or other. Give that just a second for people to respond. Okay, let's see what we got. Looks like we have about 11% of you are in medical school, third are in postgraduate training, about half are in practice and teaching, and then the rest, I think, chose not to answer, which is fine, but we're happy to help anyone, and no matter what stage of your career you're in. So there, I'm going to show the results quickly. Okay, and then with that, I am going to turn it over to Joy, who's going to start our presentation off.
Thanks so much, Scott, and hello to everyone. It's always a pleasure to be involved with the FMEC. Today we're talking about navigating the public service loan forgiveness limited waiver opportunity. And if you've heard me talk before, you know that I come to you from Minneapolis, St. Paul, Minnesota, which is the place where tragically George Floyd was murdered by the police a couple of years ago now. And so I just wanted to start by acknowledging that, acknowledging the work that you are doing for health equity, acknowledging the resistance that we see here in Minnesota, all of the organizing that's happening to overcome racism in our structures, and especially in our healthcare. And navigating student loans, as silly as that might seem, I think is a way to support health equity. So thanks so much for that work that you're doing. Today, we're going to be talking about public service loan forgiveness, the basics, also about the limited waiver, this brand new opportunity that is life-changing for folks. We'll hear a couple of stories that I'm guessing will be pretty interesting. And then we want to take plenty of time for your questions. So if you have questions anywhere along the conversation here, please drop them into the chat. We have folks that'll be watching the chat and bringing them up at the appropriate time. And we'll take time at the end as well. Then there's likely going to be a number of questions that will come up that might be too specific for us to answer. And so I won't leave you hanging. We will have some specific resources for you at the end of the conversation to get some more support if that's what you'd like. So Scott, back to you. So we have a poll. I'd like just to understand from the folks in the room, anonymously, of course, what is the size of student loan that you are carrying, or perhaps someone that you love or someone, a colleague that you know about is carrying? So no student loans up to 100,000, 1 to 200, 2 to 350, or over 350,000. So if you wouldn't mind voting, that's sort of a silly word, indicating where you might fall on this, that would help us understand. And then I'll compare that to what we typically see in the work that we do. We have the honor and opportunity to work with physicians all across the country. And every day we're talking to physicians about their student loans, and I'll tell you what we see.
Okay, Joy, it looks like everybody's done. I will share the results.
Thank you. Looks like our biggest number is in that 200 to 350. But we have people all along the spectrum here. Appreciate everyone participating. So when I am consulting with a physician on their student loans, and they always start by sending us their official list of student loans, and I open up that document, I'm expecting to see 250,000 to 450,000. Neither one of those is an outlier. Both of those are just common numbers that we see. We also see higher, 550, 650. The most we've ever seen is just a little over 800,000. And we help that doc, and she's got a great plan, and she's going to be just fine, even with a very large student loan balance. And I think that's my overall message today. If I'm going to say one thing, it's everything can be okay as long as you have a good plan. Well, I want to start with a story here. So most of the folks that just did the poll didn't have a loan balance of 0. There was one person, I think, but this actually is part of our guest's story. So I would like to introduce you to Dr. Ben Frederick to tell you a little bit about this slide. What's happening here?
Thanks, Joy, and good afternoon, everyone. So my name is Ben Frederick. I'm a family physician in Hershey, Pennsylvania, in the Penn State College of Medicine. I graduated in 2000 from medical school, so a little while ago. Honest to goodness, this is my loan balance as of today, which is super exciting. I actually checked this balance last week. We had a meeting kind of just to plan things out. And I looked at it last week, and it was still, the balance was still in place. So I decided on a whim to check it again today, and quite thrilled to see that it is actually zeroed out, which is exciting. So I'll just share with you a little bit about my experience going through this. Probably in 2018 or 2019, I remember seeing, or somebody forwarded me information about the limited waiver, or not the limited waiver, about the loan forgiveness program. And I looked at the criteria. I thought I qualified for it. And I said, why not? Give it a try, right? I didn't have high hopes for it, but because it seemed too good to be true. So I filled out the forms, had my employer sign off on it, sent it in, and I don't know, 6 months later or something, received a letter in the mail from the government saying, no, I was not eligible. And it turned out like loads and loads of people like me who applied were deemed ineligible by the federal government. So I didn't really make much of it because I figured it sounded too good to be true anyway. I wasn't pinning my hopes on it. At the Fmec conference last October, I was talking with one of my colleagues, Judd Mellinger-Blauk, and he said, Ben, you really have to go check out Navigate. They're doing people a world of good on saving money on their loans. They had a booth at the Fmec. And again, I trusted Judd. That was probably the main reason I went over to the table, to be honest, because I'd already kind of been through this, and it seemed like it was just going to be jumping through hoops for no good reason. So anyway, met with them. They told me about the story, kind of behind the scenes story of how the government was just outright rejecting a lot of these requests up front because the system that accounted for these things did not view the loans I had as the proper kind of loan. Even though I had medical school loans and qualified based on the number of payments I'd made, and I've been working for a nonprofit for all of these years. It was basically a kind of a systems issue that kicked my application and most other people's application out. So Joy described to me that there was a new limited waiver program, which I think probably Joy will tell you a little bit more about, that basically said, well, it allowed me to take my loans, go onto studentaid.gov, which, by the way, did not exist when I graduated from medical school or residency, so I didn't even know what that was until I talked with the folks at Navigate. Go onto the website, convert my loans to what are called direct loans, so that the direct loans are recognized by the federal government system, and then complete the form. So I met with Joy and her team back in October. I converted the loans over that. I can't recall how long that took, maybe a month or a little more, maybe 6 weeks, and then filled out the PSLF form, had my employer sign off on it. That was December 21st. And then Joy said, just wait, hang in there. They're getting a lot of requests, but this will take several months to turn around. I was getting some letters from the federal government saying, yes, they received my PSLF form. I received a couple of notes saying, no, I did not qualify. So of course I immediately contacted Joy and said, what's the deal? And this is probably like 2 weeks ago. I received these letters from the government saying I did not qualify. So I sent her a copy. She said, just hang in there, hang tight. This is just the standard process as they're going through this. And then, and even that was last week when we met last week, I was still a little bit dubious about the whole process until today, when I checked the website and found out that my loans.
Got to go back and look at this again just for a minute.
Right. So, yeah, it still seems a little too good to be true, but I've dug into the website. I got into all those details. Honest to goodness, it's been wiped out. So my loans, unlike some of the others that were listed, were in the neighborhood of, with interest, it would have been about 40,000 that was wiped out. So I'm thrilled about that, of course, and I'm happy to be able to participate in this evening and to share my good story with you all.
Super. Dr. Frederick, thanks so much. Seriously, we see a lot of skepticism, and I don't blame you, but I am really glad that you took those steps, and it has all turned out. And what great timing, got the $0 balance today. That's super. So let's, if listeners have questions for Dr. Frederick, please put them in the chat. We will be catching those. Let me just pause now. Shayla or Scott, is there something pertaining to that story that we should stop and talk about now, or should we just keep rolling and catch it later?
Other than just congratulations, Dr. Frederick, and thank you, Joy, for all your help with that. I think we can keep going, but that was a great example. And it takes time, and not much time really when you think about it. If it was just last fall that you stopped by the booth at our annual meeting, but it takes a little while, but it does happen.
Yeah. Thank you. I appreciate those kind words. So let's talk about public service loan forgiveness. If you are a resident or a medical student or someone, in the first, less than 10 years of paying on your loans, the limited waiver is not something that's probably going to help you very much, but public service loan forgiveness really could. So I'd like to start there. So this is a free federal program There are 3 criteria. You have to have the right kind of loans, direct loans. You have to make 120 monthly payments while you're on a qualifying repayment plan, and you need to be working full-time for a qualified employer. That could be a governmental employer or a nonprofit, a 501c3 organization. Right now, anyone with a federal student loan has probably noticed that interest rates are at 0, all the payments are paused, and all those months of paused payments are counting as qualifying payments for public service loan forgiveness. The relief has been extended 8 times now. It is currently extended through the end of August. And not only are payments paused, but all of your income-driven repayment plans are also paused. So some of you who have been pursuing this for a number of years know that under standard rules, you need to recertify your income-driven repayment plan once a year so they can tell you how much your next year's payments are going to be. During the COVID forbearance, that has not been required. If you have done that and you want to reverse that, that's something we can help you with through our internal contacts at Fed Loans. So please reach out to us if that's something that we can help you with. But here's the problem with public service loan forgiveness. In the blue, many, many people have applied for it. And in the green, chartreuse, only about 2% had success rate. So this is problematic. And that is one of the big reasons we've seen the limited waiver come into place. A lot of folks got bad information. Loan servicing companies did illegal things. People didn't know what they didn't know. And so they didn't meet the criteria. And so they weren't eligible for forgiveness. But with the limited waiver, there's a relaxing of the criteria. And so many, many more people are achieving forgiveness because they have been paying for over 10 years on their student loans while working for a qualified employer. All right, so this is the limited waiver. So for a limited time from October 2021 through October 31st of this year, the government has relaxed the rules. So no longer important what kind of repayment plan you're on or what kind of loans you had. The only rule that is still in place is that you need to make 120 payments while you're working full-time for a qualified employer. All right. So I am wondering if there are people on the call potentially that this could be helpful for, and we could maybe know that, Scott, by doing another quick poll.
Great, here we go. I'm launching the poll. Medical school graduation. When did you graduate? Let's see if people are answering. I'll give it just another minute or two for Joy and close it as soon as I see most people have answered.
Sounds good. So as I said on the top, public service loan forgiveness can be terrific for lots and lots of people. The waiver is mostly important for folks that have had their loans for a while. So we'll see on this poll if there are some people that
There we go.
qualify. Oh yeah, absolutely. Absolutely. So yeah, so folks that are in the 5 to over 15 years ago categories, or anyone else that cares about someone else that does, pay attention. So let's go through the limited waiver. Thank you, Scott, so much. So if you have those older loans, those would be loans that you took out perhaps prior to 2010. Those loans, the loan type is called FFEL, Federal Family Education Loan Program is what it stands for. Those loans under standard rules are not eligible for public service loan forgiveness. They're federal loans, but they're not direct loans. And under standard rules, only direct loans qualify. Under the waiver, those older loans will qualify if you take a step. The other group are the folks that have been paying not on an income-driven repayment plan, but on an extended plan. There's a graduated extended plan. There's just the regular extended plan. Those were very common back before 2010. And then if you are also in that situation where there's been a mistake on qualifying payment count, that could also be fixed under the limited waiver. So if that is you, you might be in a place where you could have a $0 balance like Dr. Frederick, or be close to a $0 balance just after making a couple quick action steps. So let's look at an example. Here's a physician who graduated in 2010, still owes $200,000 on their older FFEL loans. They're making monthly payments of $1,280. Their current balance is almost $150,000, and they've been working full-time at a nonprofit organization. So they've been making payments all the way along. Looks like they started paying probably at the end of 2010, because there's a grace period after graduation. So probably at the end of 2010, they started making payments on their loans. So they've been making payments for 11 years. Unfortunately, those payments, even though they met the criteria of working at a qualifying employer, they weren't on the right repayment plan, and they didn't have the right kind of loans. With the limited waiver, that physician can take 2 steps and the balance will be forgiven. They will never make another student loan payment because they've already made the 120, and whatever is left, that 148,000 will be forgiven after those 2 steps are taken and the waiting period goes by. So let's just do a little checklist about the limited waiver. So it requires full-time employment at a qualifying employer. You must submit your public service loan forgiveness employment certification form, and that form needs to be submitted to your current employer and to every employer that you worked at while you were making payments, because the federal government needs to verify that each of your monthly payments was made while you're working for a qualified employer. And then if you have those older loans, those Perkins loans or those FFEL loans, you're going to have to convert them into direct loans by applying for a direct consolidation loan. All right. Before we go to you, Dr. Josie, let's pause here for questions. Scott, can you just check and see if we have some questions, please?
We do have one question, Joy. It's for those on the call or others who don't have a lot of financial experience or time on their hands, are there options to hire someone to complete this documentation, to go through the process? Everybody's busy, so maybe there's a way to get it done another way. Do you have an answer to that?
Yep, we do. We're happy to help you do that. We'll talk more about a link at the end where you can schedule an appointment with us. And we will step you through each process. We'll actually be on the phone with you. Will you fill out the forms? It'll just take you probably 15 minutes on one and probably 10 minutes on the other, so it won't take long. And probably more importantly, as our physicians on the call here can attest, things happen after you've done those 2 steps that cause confusion. And where we really save you a lot of time is you don't have to ever call your loan servicing company again to ask questions and wait for them to answer. Most likely we can answer all of your questions for you and make sure that you are on track. Great question. I'd like to introduce you to Dr. Josie Conte, who is a good friend of Navigate, to tell her story. Dr. Josie.
Thank you so much. I am happy to tell my story. So I was inspired to go to medical school when I was in my early 40s, and I had to take about 3.5 years of post-bac, training to catch myself up so I could be ready to take on what was necessary, and got all my basic sciences and MCATs and took loans during that period of time. I went to University of New England College of Osteopathic Medicine. I started in 2006. I took a research year between my second year and third year. So I had 5 years in medical school. And then I started residency at Maine Dartmouth Family Medicine Residency. And that was in 2011. And right when I graduated, we had our capstone, and we were introduced to the idea of variations of paying back student loans. And we were told about a company to help us navigate some of our loans, not to coin your term, but help us consolidate. Well, over the course of time, as I was making my payments and getting confused and worrying and, doing income-driven repayment, there was one point where I did not know to recertify for my income-driven repayment program, and everything got reset to paying full amount back, which I couldn't afford as a resident. So, like, lots of sleepless nights and lots of worrying. I took a fellowship year, like an extra year to learn neuromusculoskeletal medicine. So I was precepting as a junior faculty, and I learned that the company that was guiding me went bankrupt. So I was really understood why I was never getting my calls returned or emails returned. So I was feeling pretty stressed out. I began teaching for Central Maine Medical Family Medicine Residency Program in Lewiston, Maine. And I attended Family Medicine Education Consortium conference where I met Joy and her company. And I really only needed about 5 minutes to realize, yes, I need your help. I really need your help. This is so stressful. I'm watching my interest flip into my principal, and as I'm making my payments every month, what I'm owing is getting greater and greater, and I didn't see a way out at all. I knew I needed to take some kind of public service loan forgiveness or national health course, something, because my family was not in a position to be able to pay off my debt. Certainly, I know going in, I was going to be making that commitment, and I'm so lucky that I get to work with medical students and residents and residency program. So I just kept making my payments. I would have my freak out every, 8 months or so, right, Joy? I'd call Joy like, what does this mean now? Or like, I'm going through my my counting of my loans, and I really feel like the numbers are off. And she was super patient and helped me advocate for myself. And then, time has passed. I am continuing to pay. COVID hits. We are now in a period where each month that I'm working in a qualifying place, which happens to be now Maine Dartmouth Family Medicine Residency, I know that time is passing. I'm keeping my eye on when is that due date. Make sure that I'm going to not miss a single payment because it just feels like I've been at it for a very long time. And so I don't know what happened. I am on the computer about 2 weeks ago. I'm making sure that I don't miss the May 1st restart of loan repayment, and my balance says 0. And I think, there's a problem. I bet I was hacked. So then I went to the studentaid.gov, and I, have to like research my password, all of that. And sure enough, it's like 0 balance. So I downloaded this little PDF of my student debt summary, and I send it to Joy. And I say, Joy, what does this mean? And
the next o'clock at night when I got that email, and I just was so happy. I was like, oh, hooray.
Yeah. And so the next morning, your response was, yay, this means you're forgiven. I'm still thinking, no, I don't think this is true. This has got to be an error.
Yeah.
It was amazing. And so, yeah, Joy went on to my account, and we found the letter that I never received in the mail that said, hey, congratulations. It said, yeah, you've satisfied your obligation and no other payments are necessary. And I started with maybe 288,000 in 2011, and all of a sudden I was owing $388,745. So that is done. It's done. And I feel the greatest relief and so grateful. Gratitude to Joy, to fortitude, to the trust, to whatever they did in October to start to do a little bit of stretch and really looking in on people's situations. I really think they're doing that. So just hang in there, and really takes some organization, which you can do, and continuing to file those certificates proof of employment. That's it.
Great story.
Yeah.
Great story. I do remember, I think it was the second year we met, Dr. Josie. I don't know if you remember this. I was at the exhibit table at FMEC. We're there every year, everyone. So just stop by and say hi. And you came up to me and said, I think it's time for me to recertify something. And so we just sat right there and opened up the computer and took care of it, you know?
Yeah.
So yeah,
Yeah.
happy to be a resource, whatever it takes, because you guys are busy. You're doing really important work. And we just want to take this off your plate.
Appreciate it.
Thanks for that story. Thanks, FMEC, for making all of this possible. So let's see what questions we have right now.
Sure, Joey, we do have a few. I'm gonna read some of them. There's a couple multi-part ones, so you may be answering a couple times. The first question we have is, so if you change to direct loans, you don't have to make 120 more payments of your now direct loans to qualify?
Isn't that like a miracle? Totally, because of that is true. It never used to be true, and it's only true for 12 months until the end of October this year, 2022. So there is a rule that says under standard times, if you consolidate your loans to a new direct consolidation loan, it'll reset the clock towards the 120 that you need for public service loan forgiveness. Under the limited waiver, that is no longer true. They're counting every single payment, every single month you've made while in repayment on every loan, even the loans that have been rolled up into a new direct consolidation loan. We've never, ever in all the years I've been doing this, have we ever seen something like this? It's hard to believe. So I understand your question, your feelings behind that question, but it is true. You will not lose your count of qualifying payments. And even more exciting is that for many physicians, they've got multiple loan sequences, maybe have 20 plus loan sequences. And sometimes the count on the different sequences gets off because a payment gets applied poorly by the loan servicing company. And so you might have, for example, 97 qualifying payments on loan sequence 1 and only 70 payments on loan sequence 2. When you do the direct consolidation and include all of your loans, what they've decided is they're going to apply the greatest number of qualifying payments to the new direct loan. So if you are a person that has that problem, I recommend you set a time with us. We'll help you figure out if it does make sense to do that. In most cases, it does. But yeah, that wasn't exactly the question, but that's sort of another benefit of the new waiver related to qualifying payments.
And here's, I think, a related question. If you paid loan payments during residency, do those payments count?
They do, as long as you have the right kind of loans on the right repayment plan and working for a qualified employer. Probably, 75 to 80% of residency programs are with nonprofit organizations. Not all of them are. And so that would be something to look into to see if your current residency employer is a qualified employer for public service loan forgiveness. During the last 24 months, no payments have been required, and all those months of non-payments count towards public service loan forgiveness if you're working for a qualified employer. If you have been making payments during these last 24 months of the COVID forbearance and you're pursuing public service loan forgiveness, you could call and ask your loan servicer to refund those payments, and they'll all drop right back into your bank account, and those months will still qualify for public service loan forgiveness.
I just want to follow up on that last point because I think it's related to another question. Someone asked, I was told there's a possibility to get loans paid back if you've completed your payments completely.
Isn't that something? That is true for some people. It's true that if you have direct loans and you've made more than 120 payments on those direct loans, they will refund. Say you've made 10 extra payments, they'll refund your last 10 payments. It's not true if you're like Dr. Frederick, if you don't mind, I use your example, who had the different loans, the FFEL loans, he will not get a refund on those payments. It's only a refund of loan payments that were made on direct loans. And you don't have to ask for that. That just happens automatically. Different from having made payments during the forbearance. You have to ask for those to be forgiven. Excuse me, refunded.
Okay, I've got two questions about the employment requirements. And one is, what is the criteria for full-time? And the second, maybe our other panelists might have a help answering, is how can you get past employers from long ago to sign those forms?
Should we start with that one? Dr. Frederick, did you have to go back to old employers to get the PSLF
I
forms?
didn't. I've been at the same employer. Yeah, probably Josie can answer that easier. The forms are easy. They're straightforward. It just needs a signature. So I don't think it's a big ask.
I was just going to mention that it's not a big ask. I had 2 employers over the course of this process. They're very particular, at least they were then. If you have any marks or any spaces that are not filled in, they will reject your request. So you just need to make sure that you don't use whiteout, you don't cross anything out, that everything is completed as they're asking on the form. So they're just really particular. Luckily I didn't have to dig through some past and find other employers, but that wasn't my experience.
Let's talk a little bit more about that question. Thanks for those stories. That confirms what most people run into. Sometimes in healthcare, mergers happen. And sometimes when a merger happens, one of 2 things will happen. Either the newly formed organization will have all the employment records from the prior organization, in which case, if you're a person who's employed for somewhere where there was a merger, whoever's the current HR department, they can sign off. They'll see the records that you've been working for them, for the other employer prior to the merger. Totally fine. That won't be a problem. We've seen a number of cases where there's been a merger and somehow the records haven't transferred. And that can be problematic. And there are 2 ways to figure that one out. One is if there is someone in the former organization that was in a position of responsibility or leadership supervision that can vouch for you that you did work for them at that time, they can sign that form for you as an official of that organization. Doesn't need to be an HR department employee, doesn't need to be a residency coordinator. The official is someone who has access to be able to confirm that, yes, you indeed did work for that employer on those dates of employment. And then the second way to address that, there's something new. It's new in the last 1.5 years. It's called the Public Service Loan Forgiveness Help Tool. You can find it at studentaid.gov/PSLF. That is the new tool that I recommend everybody use when you're filling out your employment certification forms. It used to be we'd say use the paper form. We don't recommend that anymore. We say use the help tool. It will generate the form. All you need is your employer's EIN number from your W-2. Fill out the form. It'll generate a PDF. You print it and sign it, send it to your official, and they will sign it and then either return it to you to submit, or they can submit it. The information is on the form where that needs to go. If you're having trouble accessing a prior employer's form, there is a button or a box to check on the form that says, I can't access my prior employer's information. And if you use the help tool, select that option, sign it yourself, and send it in with all the rest of the information filled out, the EIN number, the dates of employment. We have just recently heard, it was actually today that I got clarification on this, that they are accepting those, and that is actually the preferred method. So a great question.
We also had the question, maybe a quick one, what's the criteria for full-time?
Oh, right. Okay, so the criteria for full-time is full-time as defined by your employer. at least 30 hours a week. So if you're job hunting, for example, and you're thinking about working less than a 1.0 full-time equivalent, maybe a 0.8 or a 0.9 or 0.75, you must ask your recruiter or your department chair, is that, 0.8, for example, considered full-time by this organization? And if it is, and it's at least 30 hours a week, then you qualify for public service loan forgiveness under the employment. Some employers consider that full-time, others consider it part-time. So let's say your employer considers that part-time, but you're working 32 hours a week. Doesn't matter. The rule is it has to be considered full-time by your employer in order for it to be qualifying employment. The only workaround to that problem is if you're working 30 hours or more annual average per week at 2 or more qualified employers, that would then work. So we actually have someone who is working very part-time as a nursing home physician. I don't know exactly the work there, but it's just a couple hours a week, I think it is. But it was enough to have 2 part-time jobs that qualify at over 30 hours a week. So there are some really innovative things that people are doing to meet the criteria.
Great. We have about 5 or 6 more questions in the chat, so I'll try and get through them all. I'm jumping around a little bit, but we have, once there are 120 qualifying payments and a request for forgiveness is submitted, how long does it take to get a response, assuming all the qualifications are met?
Nobody knows. Yeah, it used to take 3 months. In Dr. Frederick's case, it was 4. We have folks that are waiting. It's been over 6 months. And so just keep waiting. Check in with us anytime you get a letter that seems odd. We see a lot of letters. What's happening is people are getting letters from Fed loans that are related to updates on counts of qualifying payments that are incomplete. The U.S. Department of Education is doing a recount, and every time they send a batch of new qualifying payments over to Fed loans initiates a letter sent out to the borrower. And in many cases it says, like in Dr. Frederick's case, you don't qualify. And that's just like heartbreaking, right? Because, a person thinks that they're doing everything right. And in most cases they are. And really what it is just a series of incomplete letters until all of the payments sort of catch up to that magic 120. So don't despair. Do take those letters seriously, because there might be a problem. Work with us or somebody like us, and seriously, we will help you figure out what's going on.
I'm going to ask this one next because it might be related to what you were just talking about. I have 3 payments pending manual review. They're pretty clearly qualified, but they've been in that status for over a year in spite of multiple inquiries. Do you have any insights into that?
I do, yeah. With the limited waiver, the U.S. Department of Education is doing an automatic recount of all of those kinds of payments. And actually, they're not even counting payments. They're actually counting months you were in repayment. So what we're doing now that we think is emulating what the U.S. Department of Education is doing is we're having folks download their TXT file from studentaid.gov. Shoot me an email and I can tell you exactly where to go to find that. joy@navigatestudentloans.com. And then we just count the number of months that you were in repayment by looking at the TXT file. And so those should be just automatically captured by the recount. Here's a quick question for the person that asked the question. Do you have 120 qualifying payments already, or are you below 120?
You can unmute that person if they'd like to speak.
Hi, this is Creanie. No, I mean, mine is a long and complex story, and I've already shot you an email to try to get in touch with you, but I don't have, under the current guidelines, I don't, but there are 3 payments that the thing that's weird about it is that they've actually been in that status long before the whole issue of the waiver came up. And they're in pending, although I was working for the same employer that was certified with the same loans.
Crazy.
So, yeah. And then the other question was, does the waiver apply? I was told I had a denial and I had a qualifying employer because the payment, I changed employers and was 1 week moving coast to coast. So I worked until the 8th of June, then I resumed work on the 18th of June. My payment was made on the 16th. Both of the employers at each end were qualifying, and I was told the payment wouldn't qualify.
Yeah, under the standard rules, they won't, it didn't
What
qualify.
about under the waiver?
And under the waiver, we haven't had it explained to
Not
us,
sure.
but I have seen that they're being generous on their interpretation of the rules. So, you know, I'd be 50-50 on that. You know, on the old rules, it would be, they would never count it. But yeah, I think it might be okay.
Okay. You can mute me. Thank you very much.
So thanks for sharing that. Just to go back and answer, I do know that they're prioritizing anyone who's made at least 120 payments on the recount. So this automatic recount is happening. There's millions of people, right, that need to be counted. So they're starting with the people that have already made 120. So if you haven't made 120 yet, you can expect to have to wait a little longer. What will happen is you'll get an email from the US Department of Education saying something like, hey, we found 3 new payments for you. So make sure that they have your email address and it's correct. They will shoot that information over to Fed Loans. Fed Loans will send you a letter with the new qualifying count of payments. There is one other thing you can do, and I don't recommend taking action yet, but after you've gotten that letter from the US Department of Education and gotten the final letter from Fed Loans, and maybe they just give you 2 out of the 3, for example, and you think that third one really should qualify, there's a brand new reconsideration process. It's opening up in April. The part about the repayment count isn't live yet. And I don't think in your situation, I would recommend using it yet because it's really for folks that have exhausted everything. But that is a potential tool for you to use in the future.
Great. Another question, can you please explain what consolidation is versus refinancing? I've heard that one is okay for PSLF and the other makes you ineligible. Is that true?
Yes, that is true. So applying for a direct consolidation loan with the federal government means that your loans are still owned by the federal government, and so they're still eligible for public service loan forgiveness. Applying for a direct consolidation loan won't change your interest rate. It'll be rounded up to a 0.01% of a weighted average. Won't cost you anything. You might have a new loan servicing company, but really you'll still have federal loans with all of the benefits of those federal loans. Alternatively, if a borrower refinances their student loans, you could refinance federal loans, you could refinance private loans. People refinance because they want to lower their interest rates, so save money on their monthly payments and the overall amount that's going to be paid. It can be a great strategy if you're not pursuing public service loan forgiveness, or if you have federal loans with a really high interest rate, really smart to refinance them to a lower interest rate. You don't want to refinance if you want to keep the door open for public service loan forgiveness potentially in the future, because it will make you ineligible for public service loan forgiveness. Great question. Thank you.
Here's another. If I had a year of payment post-medical school before I consolidated to direct, it sounds like that year will now count. What if that doesn't bring me to 120 payments, but a year closer? Will I still get credit for those after this brief waiver expires? Or is the waiver only useful if including those extra payments brings you to the point of forgiveness?
Great question. Thank you for that. If you're working full-time for a qualified employer during that gap year, absolutely those months of payments will count. And you will need to apply for a direct consolidation. Wait a minute. I don't know what kind of loans you had. So contact us. We'll help you figure out if you need to apply for a direct consolidation loan. You definitely need to send a PSLF form to that employer in order to count those payments. And you need to potentially you need to take action before the end of October, depending on your full situation. And let's say I don't know, maybe you have 5 years in under the regular PSLF plus that year that's going to count because of the waiver. Now you have 6 years towards your 10. So you'll be a year closer, and absolutely the waiver is going to help you because it's going to count that year that before didn't count. So yeah, it's great for folks that have reached the 120 or anyone that has extra payments that in the past didn't count, but can count now.
Okay, we had a question from someone whose loan servicer, they've been getting emails from them that they will no longer be their loan servicer and they're not sure what's for their loans and moving forward with the PSLF. They mentioned the company in the chat, but I don't know, Joy, do you have any offer guidance for them?
Yep, totally. So Fed Loans announced last December they're exiting their contract with the federal government, and then I think they got begged to stay, and so they stayed for another year. So they're exiting by this December. They have promised a smooth transition to the new loan servicing company that's been identified now to be the only one to process all of the public service loan forgiveness borrowers. And that is Mohela, M-O-H-E-L-A, Mohela. We have seen some loans start to transfer. We have seen a very smooth transfer. Mohela has a great website. They are very clear in our experience so far in their communications. We are not anticipating any trouble, and there's nothing the borrower needs to do to initiate the change. It sort of happens behind the scenes, and all of a sudden you'll get a letter from Fed Loans saying your loans are transferring. You get a welcome letter from Mohela. You have the new website. If you're on direct debit, which I recommend everybody to be on if you're pursuing public service loan forgiveness, that paperwork will just transfer over. You don't need to submit that again. As with anything related to student loans, I'd always check to make sure it's happening when payments start again in September. But yeah, it is happening. That is a true thing. Those letters you're getting, it's not a scam. There will be a change in loan servicing companies.
Couple more, and then we're going to wrap up, I think. We have a listener who started work at a nonprofit in 2005, left there about 11 years later, did 5 years elsewhere at a for-profit, but just now started a new job at another nonprofit. So how do they count the months?
So say they're going to 11 with a nonprofit?
5 with a for-profit, now back at a nonprofit.
Oh. So if the borrower was making payments during those first 11 years at the nonprofit, and they have direct federal loans that are either direct or FFEL, they might have made their last payment. They will never have to make another payment. If they have 120, that means they've potentially met the criteria for public service loan forgiveness under the waiver. Might be a couple steps that would have to be taken. Let's say that maybe that person wasn't making payments. Maybe it was residency, for example, and they decided not to make payments during residency. So out of the 11 years, there were 3 years they didn't make payments. So we're just hypothetically making a story up here. Let's say they have 8 of those 11 years they made payments while working for a nonprofit. 5 years, those years of payments won't count towards public service loan forgiveness. That means they'll have another 2 left. If they have 8, they'll have another 2 years left, or 24 payments still required. You still might want to take advantage of the waiver if you have some of those old repayment plan types or the old loan types to make sure all of those payments are going to count. Need to do that before the end of October.
Great. If the program is discontinued by Congress, for example, do you think those already enrolled will be allowed to continue toward forgiveness?
Yes. And we also know back in 2012 was the biggest test of that. And there was a big push to get rid of public service loan forgiveness. And so the bill that was introduced and got some traction was to change the loan type. So instead of borrowers having direct loans, the only kind of loans they could have would be one loans. At that time, ONE was the new loan type. And we know that only direct loans qualify for public service loan forgiveness. So that's how they're going to end the program for new borrowers after the date the bill would pass. It never did pass. The great groundswell of support from the grassroots, of course. But it was a test to show us that they couldn't take it away from current borrowers. They just couldn't legally find a way to do it. So there is no concern by folks related to that. A bigger concern for you might be, what if your career changes, right? What if you decide to go into concierge medicine or something else where your employment wouldn't qualify? You know, that would be something that you might want to be thoughtful of as you're going down the public service loan forgiveness path. Life often changes more than Congress could pull this program away.
Great. I think we're almost at our time. So there were one or two questions maybe in the chat that we didn't get to, but we have your names and we will go through the chat and follow up to make
Great.
sure we get you an answer.
All right, so to follow up, let me just say, if folks would like to spend some time with us, we do consult virtually and help you with all of your student loan questions, basically. And this is how you can schedule time with us. Click on go to navigate.as.me/FMEC. The FMEC has negotiated some special discounted rates, which I'm very happy to honor. And so our standard fee is $1,000 for attending physicians who need the full service. That rate is $695. If all you need is the limited waiver service, it's $195. If you're a resident and need the full service, it's $395. So some nice discounts that have been negotiated because we love family medicine. If you have a question, you want to talk to me first, please email. I'm happy to email questions, answer emails, or set another time to talk if you'd like that too. I think that's it. Thank you.
Thank you, and we really appreciate the partnership. It's bringing a great service to members in the Northeast US, and we really appreciate being able to work with you. So just some closing housekeeping announcements. First, thank you so much, Dr. Frederick and Dr. Conte, for joining us today and sharing your stories. We really appreciate the time it took, and and congratulations on your successes. Thanks, Joy, for running the webinar. We will be, this has been recorded, and we will be putting the recording out, and we will also send with that recording the email address and the website links you just saw. I just want to make a little plug. I just changed the screen. Hopefully you're seeing, to join us in May for a few other webinars that the FMEC is doing around the social determinants of health. We have one on May 11th, one May 17th, and one May 25th. And they're on food insecurity, parks and fitness, and digital access and digital health. So you'll see some promotion of that from FMEC in the next week or so. And with that, I just want to thank everyone for joining, and hope you have a great rest of the night, and feel free to follow up with FMEC or with Navigate with more questions. So thanks, everyone.